The KingVision aBlade video laryngoscope is a portable battery-operated visualization system. It features an integrated reusable display, reusable video adapter, and a range of disposable blades for tracheal tube guidance. The system is designed to examine and visualize a patient's upper airway and aid in the placement of a tracheal tube. The main component of the KingVision system is the durable, high-quality portable battery-operated display with a TFT LCD screen, which receives images from the distal tip of the video adapter and displays the image on the integrated full-color anti-glare screen. The display has an on-off switch, a battery indicator light, and a video out port. An advanced power management system provides automatic gain and exposure control. The video adapter connects to the display in order to transmit an image when turned on. KingVision aBlade video adapters come in two sizes, adult and pediatric. Each video adapter includes its own LED light source and CMOS camera housed in the distal tip. The third component of the system is the disposable blade, which comes in two versions, channeled and non-channeled. The channeled blade incorporates a guiding channel to facilitate delivery of an endotracheal tube, or ETT, to the patient's vocal cords. Channeled blades accommodate a specific range of ETT sizes and do not require the use of a stylet. Non-channeled or standard blades contain no guiding channel and will likely require the use of a stylet to assist in delivering the ETT to the vocal cords. The KingVision aBlade system offers a complete range of video adapters and blades for a wide range of patients. Size ranges are based on teeth to vallecula data for given ages, tracheal tube sizing, and actual experience. Medical professionals must evaluate appropriate sizing on a patient-by-patient basis. Both channeled and non-channeled versions of the aBlade slide over the video adapter and connect to the reusable display, completing the KingVision aBlade video laryngoscope system. The KingVision aBlade is powered by 3 AAA alkaline batteries. To insert the batteries, remove the battery compartment cover and seat the batteries on top of the black pull ribbon, following the directional guide located in the battery well. Ensure that the lowest battery is properly seated. Next, unlock and attach the video adapter to the display. Make sure the KingVision display is off before attaching the video adapter, otherwise the video image may become distorted or fill with static. Align the white side of the adapter to the matching side of the display and slide the adapter towards the video screen while pressing together firmly. Then slide the gray locking mechanism up until the yellow stripe is no longer visible. An audible click can be heard when the adapter is securely in place. If image distortion occurs, simply cycle the display's power by holding the on-off button on the back. If, after turning the display off and then on again, the screen does not show moving images, power off, separate, and then reattach the components, making sure that the adapter and display are securely attached to one another. You can then power the display on again. To attach a disposable aBlade, first choose the appropriate size based on the patient's age, size, and other relevant factors. Select either the channeled or the non-channeled variant based on preferred tube delivery technique. With the display locked into the video adapter, press the power button to turn the device on. Confirm that the screen shows a live image. Attach the selected aBlade by aligning it so that the curved section of the blade faces the back of the display. The blade and the adapter will only fit together in one orientation. Slide the blade over the video adapter until the neck of the adapter and the neck of the blade meet. Push firmly until the blade is fully engaged into the adapter. When the LED indicator light on the top left of the display is green or off, the display is ready for use. When the LED is flashing red, the batteries need to be replaced as soon as possible. If the display is turned on with no video adapter attached, it will automatically power off in 20 seconds. This automatic power down will also occur if the fully assembled KingVision video laryngoscope is left idle on a work surface for 60 seconds. The standard or non-channeled blades are used when integral guidance of the ET tube is not indicated. In this case, the assistance of a stylet will be necessary. Lubricate the distal tip of the standard blade using a water-soluble lubricant, taking care to avoid covering the distal window of the blade with lubricant. Lubricate the stylet and the ET tube. Preload the stylet into the tube and bend the tube to match the curve of the blade. Open the patient's mouth using the standard technique and suction any excess secretions in the airway. Insert the blade into the mouth following the midline. As the blade advances into the oropharynx, use an anterior approach toward the base of the tongue. Watch for the epiglottis and direct the blade tip toward the vallecula to facilitate visualization of the glottis on the display screen. The tip of the aBlade can be placed in the vallecula like a Macintosh blade, or it can be used to lift the epiglottis like a Miller blade. For best results, center the vocal cords in the middle of the video screen. Once you can see the vocal cords on the display, insert the tube with the preloaded stylet into the mouth until the tip reaches the posterior pharynx. Then manipulate the tube to direct its tip toward the vocal cords. Advance the tip just through the cords and then retract the stylet prior to advancing the entire tube into position in the trachea with the cuff below the cords. The channeled blades are designed to be used with standard endotracheal tubes without the assistance of a stylet. To begin intubation with a channeled blade, lubricate the ET tube, the guiding channel of the blade, and the tip of the blade with a water-soluble lubricant, taking care to avoid covering the distal window of the blade. The ET tube may be preloaded into the guiding channel with its distal tip aligned with the end of the channel. The tip of the tube should not be evident on screen when loaded properly. Alternately, the ET tube can be inserted into the channel after the blade is already in position and the vocal cords have been visualized. Advance the tube slowly and watch for the cuff to pass through the vocal cords, manipulating the tip as needed. Once the tube is inserted, separate it from the blade by pushing it away from the soft molded channel and retracting the blade. The most common issue associated with ET tube placement with any video laryngoscope is that the blade tip is advanced too far. This may provide a good close-up image of the vocal cords, but the tube cannot advance further due to the blade obstructing its passage. To address this issue, follow the anterior surface of the tongue and place the blade tip in the vallecula. If too close to the vocal cords, withdraw the blade slightly to obtain a more panoramic view. Gently lift in an anterior direction prior to attempting to advance the ET tube. After completion of any procedure, separate the display and video adapter from the aBlade and dispose of the blade following local guidelines. Disinfect the display and video adapter. If the display or adapter are visibly soiled or suspected to be contaminated, proceed to the advanced cleaning steps outlined in the KingVision aBlade video laryngoscope instructions for use found at www.ambuusa.com.